All right, here we go. Good afternoon, everybody. Welcome to our webinar for Thursday, April 23rd. And now that it's 1 o'clock, we are going to get started. There we go. So I'm going to be your host today. My name is Rob. I'm a kinesiologist, cardiac rehab supervisor here at Toronto Rehab. And today I'm going to be talking to you about resistance training, something that's very, very important. We're going to talk about why you should be doing it, talk a little bit about how you can be doing it. Hopefully you'll add it to your routine if you're not already doing it. So some goals that I'm hoping to be able to cover today, just as I said, talk a little bit about weight training and why I think you should be including it to your weekly routine of heart healthy living. Some of the things you need to do from a safety point of view in terms of weightlifting. I know there's a lot of people out there that have their cardiac problem and they get referred into our program. And whenever I talk about resistance training, I do a quick survey, show of hands, how many people were out there were told to be careful with lifting stuff by their doctors when they left the hospital. And it's a fair number of people. So we'll talk a little bit about that as well. And then share a few resources. And I want to be upfront about this. We're going to have a couple of sessions on resistance training. There's a lot of different ways to do this. So today's session is going to be more of a high-level session, just talking about some of the pros and cons. I will share a few very simple exercises that people can start off doing. I know they're basic. They don't need an awful lot of exercise equipment. My hope is maybe you can work these into a routine. So in 2 weeks, when we have our more in-depth session on different resistance training exercises, you'll already have a routine and a pattern established. We all know how important that is. So just a couple of ground rules. And for people who have caught into these sessions before, this might seem a little repetitive, but it's always important to say. These sessions are for education only. These are being broadcast live to quite a wide variety of people, some young, some old, some fit, some less fit, some who know an awful lot about resistance training and some don't. So my information is going to be for general purposes only. Specific questions, best to talk to somebody who specifically knows you. So talk to one of your healthcare providers. All right. Personal questions, I'm not going to answer them personally, but if I can generalize them to an answer that other people will enjoy hearing, I'll do so. And at the end of my session, 25 minutes or so from now, I'll do my best to answer as many questions as I possibly can. If I don't get to them, feel free to send them in, and I'll do my best to answer them by text. And we'll post those answers for people to look at later. Okay, just a reminder, if you have any questions, use the Q&A button down there at the bottom. I'm not going to be answering them to the end, but if you put them in the Q&A section, my colleague Crystal here, who is helping keep me on track, will make sure I know what all the questions are. Why should you lift weights? If anybody caught into my session that I gave a couple of weeks ago, we talked about the different components of leading a heart-healthy lifestyle. And there were 4 key components that we talked about back then. We talked about aerobic training or cardio. We talked about stretching. We talked about not leading a sedentary lifestyle, getting up and moving an awful lot. If anyone's watching this, feel free to stand up. That's good for the sedentary behavior. And the 4th component is resistance training. So resistance training is something that we've been doing here in cardiac rehab, I think probably for about 15 or 20 years now, and it's come quite a long ways. I know when I first started working in this field 25, 26 years ago, the general thinking was that cardiac patients shouldn't lift weights. There was a concern that if you're going to lift weights, and you're going to be straining the weight to lift the weights, it's going to increase the pressure in your chest cavity and clamp down on all these muscles, and that's going to result in a big, potentially dangerous increase in your blood pressure. That was back in the 80s and 90s. We've learned an awful lot in the last quarter century. And as it turns out, the resistance training that we tend to encourage, which is resistance training that's meant for overall health and wellness, if it's done properly, really does not have these big, dangerous spikes in blood pressure. And as a matter of fact, if you go and take a look at the guidelines for what makes up a good cardiac rehab program, the American guidelines, the Canadian guidelines, and the European guidelines, all of them say the same thing. for cardiac rehab program to be considered effective, it needs to include resistance training. So this should be a real big part of everyone's heart healthy lifestyle. And it's one of these things that now is really the great time to start including resistance training. I call a lot of people week after week talking to them about exercise. And one of the barriers with aerobic training that comes up is, Rob, I'm stuck in my small little condo. I'm walking tiny circles. I'm going crazy doing this. And that can be a challenge. But the neat thing about resistance training is you just need a small little area and it's done stationary. Well, this is the perfect time when we're all trying to physically isolate from each other to start adding some resistance training into your program. So maybe a silver lining to this big black cloud that's hanging over our heads right now. So why should you do resistance training? So benefits here on the slide that we have. Increase muscle, decreases fat. A lot of people are often asking, how can they make positive changes to their body composition? How can I lose weight, tone up my arms, tone up my belly, all that kind of stuff? Well, anytime you're talking about body composition change, resistance training is really, really important. It burns calories for a very, very long period of time. One of the theories why a lot of people, as we get older, will start putting on a little bit more fat mass is we don't lift weights nearly as much, and we lose muscle mass. And as we lose muscle mass, our metabolism starts to drop, and that makes body compositions become a little bit of an issue. All right, so increasing muscle mass is really good. Of course, the stronger you are, the more activities of daily living, ADLs, that you can do. This is kind of important in terms of living independently as well. You know, as we get older, as we lose muscle mass, it becomes harder to do things, harder to stay living on your own. So that's going to be a little bit of a concern as well. Resistance training also, it makes you feel good about yourself. Boost your self-image and confidence when you're doing those kind of weights. It lets you do more. You feel better about yourself. Decreases risk of injury. So what I was talking with a patient yesterday, and I think she's probably tuning in here. I won't share names, but this is a lovely lady, a little bit older, who I hadn't spoken with a few weeks. And then I gave her a call to see how she was doing. And she said, oh, I'm doing good. But I haven't done my exercise in a while, and I've noticed my balance is just terrible. I have to use a walker just to get around the apartment anymore. There are a number of things that contribute to your balance and maintaining good balance and decreasing falls risk, and having adequate strength is a real big part of it. So she hadn't done as much exercise as she was supposed to. She ended up losing a fair bit of leg strength, and then the result is she had to resort to using a walker to avoid falling down. So that's a big key as well. Delays prevents osteoporosis. Of course, a lot of the women are going to be really into this. They know that. But osteoporosis is also a concern for men as we get older as well. And for those of you who know, falling can be very, very dangerous. My mom is 75. I'll share with you, she fell 3 weeks ago, just a fall, and she broke her hip, had hip replacement surgery. So avoiding falls by maintaining strength is really important, and trying to keep your bone density up as good as it can be is critical as well. And the last one we have there is improves blood glucose. I like to tell my patients that nothing pulls sugar out of the blood like resistance training. For anybody who's got diabetes, you know, trying to maintain your blood sugar at a level is very, very important, and resistance training is a great way to do that. Okay. Now, one other thing that's not here that I just want to share, because I get this question an awful lot. I have a lot of patients that are a little bit older, and they say, oh, Rob, you know, I'm too old. I've got arthritic knees and stuff like that. I really shouldn't be doing the weight training. That's the absolute worst answer that you could possibly give, especially with arthritic joints. For most arthritis, we know that arthritis is a wearing down of the cartilage in the joints. And as that cartilage wears down, it starts to cause some pain and discomfort as you get bone rubbing together. If you have, let's say, knee arthritis, and the muscles around the knee are really weak, you can kind of imagine that knee joint is going to be sliding around because you've got weak muscles. And that sliding around is going to cause a wearing down, further wearing down of the cartilage. But if you start doing weight training and you make those leg muscles nice and good and strong, you're not going to have nearly as much slopping and sliding around. And while it's not going to make your arthritis better, what it is going to do is it's going to make it less likely to get worse. So if I were to pick on any one patient group that really needs to be doing resistance training, it's older patients who've lost a lot of muscle mass and have arthritic joints. Resistance training is great specifically for that group. 3 participants raised hands. I'm going to hope that that's just questions and I'll deal with them at the end. Okay, next slide. So, am I saying everybody can do weight training? Yeah, pretty much. There's a few things that you need to be aware of that would result, if you were here with us, in us modifying the weight training program. So we got like 6 little points here on the screen. The first one is a hernia. A hernia is typically when you get a weakening in some of the muscle tendons and stuff like that, and you get a little bit of a bulging out. So for guys, sometimes you can get into the groins. You can get those inguinal hernias there. You can get them in the stomach as well. If you have a hernia, we just need to be careful in terms of how you do the resistance training. So high level example, if you've got a hernia in your belly, where the belly button is, or maybe from a surgery, and you're going to start doing sit-ups, that's going to put a lot of pressure on the hernia, and that might make the hernia a little bit worse. So we need to modify the exercises to do that. So that's one thought. Eye complications. So generally speaking, most people with eye problems like glaucoma and stuff like that tend to be okay as long as the medical condition is well controlled. If there's anyone out there who's got something called proliferative retinopathy, this is an eye complication from diabetes where the blood vessels in your eyes can be very, very fragile. We need to be very careful in that situation because we can damage some of the blood vessels, which can lead to vision problems. So proliferative retinopathy associated with diabetes mostly is a concern. High blood pressure. Well, I mean, we all know that high blood pressure is a problem, right? That's a risk factor for heart disease and for stroke. So you need to have your blood pressure controlled. This is a screen that we do for any kind of exercise, not only resistance training, but aerobic training as well. If you've got high blood pressure, you really need to get that under control before you do any exercise just to be safe. And then other things that we consider as well. We typically work with an older population. So can you get up and down off the floor comfortably? If you can, great. There's certain exercises that are done supine or on the floor that will get you to do. If not, that's good too. We will just give you exercises that are done seated in a chair or maybe standing, just to kind of get rid of barriers. Because if we make it a little bit easier for you to do, it's more likely that you're going to do it, right? And developing those patterns and those habits, that's really the hardest part of any kind of exercise program, including resistance training. Any joint or back problems, once again, this would not preclude you from doing resistance training. It would just force us to modify it a little bit. If you've got really bad knee and hip problems, for example, we want you to strengthen your legs. It's good for the joints, but maybe doing half squats are not the right exercise for you. Maybe seated leg extensions are better. So not an absolute can't do weights. We just got to think about it. And then also some people, a lot of our heart patients, you guys are on a lot of medications, many of which will lower your blood pressure. It's not unusual for us to have patients that say, oh, if I stand up too quickly, I get a little bit dizzy. That's just something that we need to be aware of. And when we're getting you to do your resistance training, maybe take an extra 5 or 10 seconds from one exercise to the other, or switching positions, just to allow your body and your blood pressure and your hemodynamics to adapt to those changes so that you can stay safe. All right. But generally speaking, the resistance training that we advocate, pretty much anybody can go and do it. And I said this at the start, but just a reminder, that our resistance training is designed for health and wellness. We're not looking to turn anybody into a bodybuilder. We're not looking to turn somebody into a big power lifter or anything like that. We're just doing this because resistance training is important to make you healthy. So that's the goal here. We look at a combination between strength and endurance, which is practical. It's very functional. It'll help with all the health things like blood sugar, blood glucose, as I talked about, help with stabilizing joints and things like that. But endurance will also help dramatically with activities of daily living too. So we do a combination, typically 10 to 15 repetitions at a light to moderate weight. My slide says moderate weight. Keep in mind here we've got a supervised program. If you're doing this on your own, I always encourage people to err a little bit on the side of caution and maybe start off with something that's a little bit lighter and a little bit easier, just until you can develop the habit, develop the routine, and then once you're comfortable with things, slowly ramp that resistance up to more of a moderate weight. Okay, so resistance training can be pretty complicated if you want it to be. There's an awful lot of stuff that you can talk about in terms of the health and physiology. Likewise, there's, I think, a million different resistance training exercises that you can do out there. So the slide that I have right here shows our standard resistance training program that most, not all, but most of the patients here in our cardiac rehab program will progress through. You can see there's 4 supine exercises here, numbers 7 through 10. So obviously we get a reasonable number of patients who are not comfortable getting up and down on the floor. So we have alternative exercises that will work the same muscle groups, accomplish the same things, but they can be done from a seated or a standing position, okay? Now, I said at the beginning, I'm not gonna be able to go through the entire program today. Tune in 2 weeks from now, where a colleague of mine, Renee Kanitas, and myself will actually go down to the gym and we will go through an entire weight training routine, right? What I'd like to do today is just show you 3 exercises that everybody should be able to start doing today. Now, before I show you those 3 exercises, just a couple of terms and definitions, just so that we're all on the same page. When you hear me say the term repetition or a rep, that means you're doing one motion of an exercise. So here in the graphic that we have colleague of mine, Daryl Dukes, who's doing a bicep curl. So one repetition would be lifting the weight from by his leg with his arm straight up to his shoulder. That would be one repetition or one rep. Typically, when we prescribe repetitions, we prescribe sets, or when we prescribe resistance training, sorry, we prescribe sets of 10 repetitions. So if I say do a set of bicep curls, that means you're doing 10 repetitions of the bicep curls on each arm. So you do one on the left, one on the right, a second on the right, second on the left, third on the left, third on the right, and so on until you get up to 10, and then you've done your one set. So we've got repetitions or reps, we've got sets, and then the third term is a circuit. A circuit is doing all the exercises that we might assign one time. So in the previous slide, I've got 10 exercises. So a circuit would be starting at exercise 1, then going 2, 3, 4, all the way through to 10. That would be one circuit of 10 exercises. And typically when we prescribe exercise, we prescribe 2 circuits. So you go through all 10 of them once, and then you go to the beginning and go through all 10 of them again. That would be 2 circuits. All right, so we're all hopefully on the same page in terms of the terms, definitions that we use. Okay, so I'm a big believer that the hardest part of exercise isn't doing the exercise. We can make exercise so that it's really simple and easy and straightforward to do, to a level that I don't care who you are, we can make you do something. And I work with people waiting for heart transplants. I work with a lot of very, very sick people. And I can find exercise that all of them can do comfortably, safely, and easy. The hardest part of exercise is creating a routine. It's creating a habit where you actually start doing this on a regular basis. All right. So with that thought in mind, I want to share 3 exercises that pretty much everybody should be able to do. And these 3 exercises might take you all of about 3 minutes. And I might ask you to do it 2 or 3 times a week. So we're looking for a crazy 10-minute a week commitment here. All right. And I know a lot of people are trapped at home with the COVID stuff going on. So you've got the time. Everybody's got the time. So the first exercise I'd like to suggest is this one that we see here that's called a half squat. If you go to any weightlifting gym and you talk to all the body lifters and all those big muscle guys, a lot of people will refer to squats as the king of exercises. It's one of the best resistance training exercises you can do. Targets the biggest muscle groups in the body, the quadriceps. It's what we call a compound exercise. So while it does work the quadriceps, it works numerous other muscles. It's a really functional exercise as well. So it helps you walking around, which I mean is key. Little things that a lot of people take for granted until they get older and they can't do it. Getting up out of a chair, getting up off the toilets. These are hard exercises. They're important to do. Squats are hugely helpful for that. They also target the muscles that work around the knee joint as well. So for arthritic patients, if you can find a way to strengthen your quadriceps, which is what squats will target, that will help with strengthening the muscles around the knee joint, helping with arthritis. It's a very simple exercise. All you need to do is stand up with your feet about shoulder width apart. Make sure that you kind of flex your tummy a little bit, protect your core, and then all you're going to do is slide a chair behind you, and then you're just going to lower your seat down as if you were going to sit in the chair, but don't sit. I want your buttocks to lightly kiss the chair and then come right back up. We usually suggest people do this in front of a chair just to help with a little bit of balance. If you do lose your balance, instead of falling down to the floor, you'll fall into the chair. So that's good. Can also help with not going down too far. You don't need to go significantly lower than what you would have in terms of a chair. So that's a good way to start. If balance is an issue for you, one of the things that I'll often recommend to people is, you can see in the picture, our model has got his hand straight out in front of him and he's not holding on to anything. Well, pretend that he's holding on to a kitchen counter, or he's got his hands inside the sink. That might give him a little bit more balance, so he doesn't have to worry about losing balance, and he could still have the chair in front of him just in case he gets a little bit fatigued. So half squat, excellent exercise to start with, and as I said, often referred to as the king of exercises, very functional exercise to do. A second exercise I'd like to suggest is something called the heel raise. And this one's really simple. You just stand with your feet shoulder width apart, and then just go up on your toes as high as you can. So you're raising your heels up off the ground. So you just go up and then go back down. That's going to work the muscles in the lower legs, the gastrocnemius and the soleus. Those are good muscles to work as well. Once again, a very, very simple exercise. If balance is a little bit of a concern, we'll usually tell people just to hold on to a tall back chair or a counter, just so that they have a little bit of balance. Remember, even though increasing your strength does help with balance, resistance training exercises are not meant to be balance exercises. So when you're doing your heel raises, don't think, well, I'll just do it without holding on to anything so I can work on balance as well. I'd much rather you hold on to something so you can focus on the exercise properly and look at increasing your strength. Okay. The third exercise that we have here is a bicep curl. And that's going to work the muscles in the arm. Very, very simple to do. And I'm throwing this in here just to help people out. There are a number of different ways that we can apply resistance to a muscle. All right. So the most common one that you see in all the gyms and lots of places is using dumbbells and weights. And just by lifting that muscle up against, or lifting that weight up against gravity, you're applying resistance to the muscle. And if you do that often enough, that's going to encourage the muscle to have some cellular changes, and it's going to get stronger. So weights are a very common way to apply resistance. Rubber bands. So I have what we have here, a type of rubber band called TheraBands. There's lots of different ones out there. They're just big rubber bands. And of course, as you stretch them, they get harder to stretch. That applies resistance as well. So you'll see those used in a lot of places. Physiotherapists, a lot of the time, like using elastic bands. Body weights. So the example that we showed with doing the half squats, that's an exercise where you're using your own body weight as a form of resistance. When people are doing chin-ups or push-ups, those are also body weight exercises, and they can be fantastic. One of the biggest problems that I get right now with patients is they say, Rob, I get it, resistance training, it's fantastic, I'm going to do it, but I've got no weights and no bands. And for some of our older patients, you know, doing push-ups and stuff like that can sometimes be challenging. So what other stuff can we use? So a couple of things that I want to mention, a lot of my colleagues are saying this. just grab a soup can. All right, so for your bicep curls, you know, a can of soup might be 2 or 3 pounds, and that's actually a pretty reasonable weight for our lower functioning patients. Okay, so that would be one option. Another option, which a colleague shared with me, Madeline, if you're out there, thank you for this. This was a fantastic idea. A lot of people have these 500 ml bottles of water. We've got them here. Nestle is one company, one of many companies that make that. Well, it turns out a 500 ml bottle of water weighs about 1 pound. We've all got bags kicking around, grocery bags, cloth bags. Well, if you want to do your bicep curls, well, just throw a 500 ml bottle of water into the bag. If one bottle's not enough and you want to go up to a 5-pound curl, a 10-pound curl, a 15-pound curl, well, that's 5, 10, 15 bottles of water. And you can throw it in there and then you can just bicep curl the bag up. So it's nice. I like it because it's reproducible. So if I'm going to do some weights on Monday, when I do my weights on Wednesday, I kind of like, you know, to be consistent with the weights that I lift. That's important because you want to send the consistent message to your muscles. If I'm doing bicep curls at 4 pounds, I'm telling my muscles, get strong enough to lift 4 pounds. If it's 3 pounds one day, 6 pounds the next, a little bit of a mixed message. So I'm a big fan of consistency and resistance training and aerobic training as well. So using water bottles would be a neat idea as well, okay? And only because for people who know me, you know, I like to think I'm a pretty fun guy. This is not how I'd like you guys to do your bicep curls. I don't want people curling glasses of wine. So putting the big red X on that one. Don't do that one, okay? So resistance training, unlike aerobic training, should only be done 2 to 3 days per week. Weight training and resistance training works on an overload principle. So for example, if your biceps can comfortably curl up 5 pounds, we're going to ask it to curl 6 or 7 pounds, which is more than it might comfortably be able to handle. And what that's going to do is that's going to encourage some cellular adaptation, which is basically a fancy way of saying it's going to convince your muscles to get stronger to handle that overload situation. And that's how we increase our strength. The thing is, part of that increase in strength, we're doing a little bit of damage to the muscles, tiny, tiny amounts on a cellular level when we're doing the lifting. We get stronger when the body repairs that damage, and that might take like 1 or 2 days. So it doesn't make sense to lift weights on, let's say, a Thursday, do a little bit of that cellular damage, and then lift again on Friday, because you haven't had the chance to recover and actually get stronger. All right. So don't do it more than 2 to 3 days per week. And I will typically tell people to always have a day of rest between their sessions. Okay. So that is, as I said, a very general high level overview. My big hope from this particular session is that I've at least convinced you guys that you really need to be doing resistance training. It doesn't take an awful lot to do. You don't need fancy equipment. You don't need an awful lot of time. It's only 2 or 3 times per week. Hopefully you guys will at least think about adding 1 or 2 exercises to your routine a few times a week. And then tune in a couple of weeks when my colleague Renee Kanitas and I will actually take a look at this resistance training session that we did today, and we're going to expand on it, and we're going to share a lot of different exercises that you can use. But the key here is to make sure you include this into your heart healthy living routine, develop a pattern so that when you come back in 2 weeks, you've already got that part covered, you're excited, you're motivated, and then we can look to tweak and modify the pattern. All right, for everybody who's keen out there, if you'd like a few more resources, a couple of websites here. British Heart Foundation is one. I'll put in a plug for our own Cardiac College videos. We've got quite a robust section on resistance training. All those 10 exercises are listed there, along with videos showing you how to do them and a little bit more information on general resistance training. So feel free to go take a look at that if you're really motivated. Okay. And just along the sign of motivation, when you're looking at the resistance training, one of the things I'd like everybody to do is to do it because you guys want to. You know, I really don't like it when people say, oh, I'm doing it so that when Rob calls me next week, he'll be really happy. I mean, I appreciate that you're doing it. It's fantastic, but nobody should be doing any of this stuff for me. I mean, in the grand scheme of things, you guys are the ones that matter. You should be doing it for yourself, for your loved ones, your family. So make sure you're doing it for the right reasons and really think about that. Don't think about me, okay? except for maybe my Wednesday guys. I'll be calling you later today. Okay, a few more resources. Once again, I mentioned Cardiac College. We've got the resistance training session information on there as well. We've also got a big workbook, our Get Active workbooks there. There's a short 5-minute video called Start a Resistance Training Program in the Thrive section. Feel free to take a look at that after I'm done this one. And as I said, if you guys can go about adding just 2 or 3 exercises 2 or 3 times per week, it doesn't take an awful lot. Do that for 21 days. It's 21 days to make a habit, and that will make you a much healthier, tripping over my words. It will make your heart that much healthier. There we go. I need my coffee. Okay, so what we learned today, hopefully I've gone over the benefits, talked a little bit about the safety stuff. As I said, everybody can do it. But if you do have hernias or joint problems, it might be a good idea to talk to one of your healthcare providers just to make sure you're doing it safe. And of course, I've outlined some of the wonderful sources that are available on the nets. Open. What is best exercises to improve balance? Had knee and hip replacement already. So as I mentioned at the start of this particular session, balance is really key. Strength plays a big factor in terms of balance. So for this particular thing, I would be looking at strengthening strengthening muscles in the lower half of the body. So quadriceps, calves, and maybe your hamstrings. So those squatting exercises is probably a good exercise. However, if you've had knee and hip replacement, you might have some limitations in terms of how far you can go down. So if you're able to do what's called a quarter squat, so a half squat, I'm suggesting you just go down to a chair and you get close to the chair and then you come back up. That might aggravate your knees if they've been replaced. So maybe go a quarter of the way down. So maybe only just squat down a little bit. That's one option. There's another exercise that we have on our website that I'd like to plug for. It's called a seated leg extension. So that's just where you're sitting down in a chair and then literally you're just straightening your leg out and then you're bringing your leg back bent to 90 degrees. So doing that repeatedly, if you can add a little bit of resistance over the foot, that would be fine. If you've got an ankle weight or something like that, that's probably the best place to start. But with the hip and knee replacement, my hope is that you would have had some physiotherapy after those surgeries. I can pretty much guarantee they would have given you exercise to address those. So that's probably a good place to start. Any suggestions for improving posture with resistance training? Oh, absolutely. Do I ever? So we have some muscles in the back, a number of muscles in the back. Rhomboids are one of them. A lot of people, and probably me as I'm doing this presentation, you can see I'm starting to get a little bit hunched forward. That stretches all the muscles in my back and weakens them. So an exercise that you could do is just a rowing exercise. Number of different ways to do that. Probably the simplest one, which we can do without any weights and generally safe to do, is just to stand there. And then what you can do is you can try and have your shoulder blades in the back touch. Impossible for me to show this on a screen that's like 2 inches by 2 inches. But if you can picture standing up and then drawing your shoulders, see if we do it this way, if this helps at all, drawing your shoulders back as if your shoulder blades were touching. And you can start off with that, just doing 10 repetitions of that. This one you could actually do a couple of times per day. And what that's going to help is that's going to help tighten the muscles in the back. And then it's going to be just like my mom's always telling me, stand with your shoulders back. Well, if I strengthen the muscles, I pull my shoulder back, it gives me a little bit better posture. So I'd probably look at doing rowing exercises. What else do we have? When you're doing 10 repetitions of a bicep curl, do you alternate arms or do 10 with one and then 10 with the other? So if I'm doing bicep curls, do I do 1, 2 like this, or do I like this, or do I do 10 like this and then 10 like that? I typically encourage patients to do 1, 2, 1, 2. Gives you a little bit more of a balanced workout. The arms will recover a little bit because you're not working. You got a little bit of a pause in the right while you're doing the left. So I tend to do 10 like this. I tend to avoid doing 10 like this for my cardiac population. The more muscles you use at any one time, the more oxygen rich they need. So if I'm doing this, I'm working my right and my left arm So I need more oxygen rich blood than if I'm just doing one like this. So I tend to try and do single limb as much as I can. And I would alternate like that. Is after your walk cardio exercise a good time to do weights or resistance training? So we will, a lot of the time, let people decide what feels better. One of the things I usually encourage people to do is to make sure they do a little bit of a warm up before they go and do their resistance training. I mean, anytime you're working muscles, you need to deliver oxygen-rich blood, and your body needs to kind of optimize the blood flow in the body to make that happen. As we get older, if we have coronary artery disease, that's not optimal. So making sure you give your body a chance to warm up, it makes sense. If you're going to do your aerobic training prescription as your warm up, I mean, that works. That works really well. However, if you've got a long walking prescription and you really just don't want to work out for an hour and a half, let's say, you can do the weight training on your own. If you want to do the weight training first and walk after, that would be fine. Just make sure you do a little bit of an aerobic training warm up. The dynamic warm up I talked about in my session 2 weeks ago would be perfect. Warms up a lot of the major joints in the body, gets the blood flowing. That would be excellent. What is the soonest one can start resistance training post open surgery? I'm assuming open heart surgery with a sternotomy. So if you've had valve surgery where they've opened up the chest or bypass surgery, kind of hard to give a blanket answer for that because there's an awful lot of variables. If I have somebody who's 45 years old with congenital heart disease, fairly fit, no diabetes, they would heal up probably quicker than somebody who's 85 years old and had diabetes. So it's kind of hard to say it needs to be this much time. Generally speaking, you want to make sure that you've had follow-up with your surgeon to make sure that everything is healing properly. You shouldn't have any pain when you're doing the resistance training. If you do the resistance training and you're feeling that you're getting chest pains building up, probably too soon. Definitely no sooner than 6 weeks. We will typically start resistance training here in our program about 12 to 16 weeks roughly after surgery. And it also depends on the exercises. You can start doing bicep curls at a low weight pretty early. If you're going to be doing supine flies, which targets the chest, you might want to wait a little bit longer. So if you have a specific question, you can always email me and I'll see if I can answer that a little bit more. In future sessions, can you include instructions on breathing techniques while doing weights? I'll add that right now. Very, very good questions, Brent. Thank you so much for putting that in. Whenever you're doing the work phase of an exercise, you should be looking to breathe out. So if I'm doing bicep curl, we know the hard work of a bicep curl is when I'm lifting the weight out. So I should be breathing out, then breathing in. Breathing out, breathing in. You really want to make sure that you don't breath hold. Breath holding is one of those things that does increase the pressure and can cause your blood pressure to go up. So make sure you breathe comfortably. That's the first thing. If you can do that comfortably, make sure you exhale on the work phase of your exercise. And if you're doing your bicep curls like this, it's kind of hard because you're always kind of lifting something. Breathe comfortably, okay? Those are some general guidelines. I have retina eye problems due to diabetes. Which exercise not to do? So Catherine, I'm assuming here, and I don't have all the details, that if you're talking about something called proliferative retinopathy, which is where you get blood vessels growing through the retinas of the eye due to diabetes, I would probably encourage you to not do weight training without talking to a healthcare provider. If you're actively here in the program, I'd reach out to your cardiac rehab supervisor to get some clear instructions on that. If not, here in the program, talk to your GP. The concern that we have is if I give you the wrong answer, you could end up doing lasting harm to your eyes, which is why I'm going to suggest you talk to somebody who knows you a little bit better than myself. And I think that's it for my questions. So I'm going to come back to here. Our next session is on Monday. And I think the topic, Crystal, what's our topic? Sleeping well? Oh, wow. Okay, so the next session is a big one. I know a lot of people I've been talking to have been having issues with sleep, just getting up and all this kind of stuff with all the stress that many of us are going through with this COVID, with the isolation, which with us messing up routines. all of this contributes in a really bad way to sleeping well. And if you're not getting a good night's sleep, it definitely has health consequences. So that's going to be our next session coming up next week, same time, 1 o'clock, same place, except you won't be seeing me. It'll be one of my colleagues giving the session. All right, folks, thank you very much. Have a great weekend, and more resistance training information will be coming in 2 weeks. Thank you, folks.